Welcome to our presentation on heart murmurs, a comprehensive guide. Heart murmurs are a crucial topic to master, particularly for medical exams, as they offer valuable insights into the health and function of the heart. Throughout this comprehensive guide, we will delve into the key attributes, qualities, and locations of various heart murmurs. Additionally, we'll explore the techniques that can amplify or diminish these murmurs, providing you with a thorough understanding of their characteristics. By mastering these concepts, you'll be better equipped to identify and differentiate between different heart conditions, leading to more accurate diagnoses and effective treatments. So let's embark on this journey to uncover the intricacies of heart murmurs and enhance our ability to care for patients with cardiac issues. Now, let's delve into the essential aspects of memorizing heart murmurs. Understanding the specific attributes, qualities, and locations of different heart murmurs is paramount, especially for medical exams. Focus on committing to memory key murmurs such as HOCM, hypertrophic obstructive cardiomyopathy, MVP, mitral valve prolapse, PDA, patent ductus arteriosus, and ASD, atrial septal defect. This knowledge will directly leverage your performance on the exam. Additionally, it's crucial to learn the various techniques that can amplify or diminish heart murmurs. These techniques include hand grip, Valsalva maneuver, standing, squatting, inspiration, and exhalation. Understanding how these maneuvers affect murmurs will be essential for accurate diagnosis and interpretation. Pay close attention to the timing and characteristics of murmurs as well. These factors can help differentiate between different heart conditions. Familiarize yourself with the unique features of each type of murmur to enhance your diagnostic skills and clinical decision-making. By mastering these aspects of heart murmurs, you'll be better prepared to tackle exam questions and clinical scenarios with confidence. Let's unravel the differences between two distinct audible heart sounds, pericardial rubs and pericardial knocks. While both may indicate pericardial involvement, they originate from different underlying pathologies and have distinct characteristics. Pericardial rubs are hallmark sounds of pericarditis, a condition marked by inflammation of the pericardium, the protective sac surrounding the heart. These rubs are often described as scratchy or grating, resembling the sound of sandpaper rubbing against wood. They occur when the inflamed pericardial layers rub against each other during the cardiac cycle. On the other hand, pericardial knocks are characteristic of constrictive pericarditis, a condition where the pericardium becomes both inflamed and fibrotic. Unlike pericardial rubs, which arise from inflammation alone, pericardial knocks result from the stiffened, fibrotic pericardium impeding normal cardiac motion. This leads to a distinctive knocking sound during the cardiac cycle, akin to the tapping of a drum. It's crucial to distinguish between pericarditis and constrictive pericarditis, as they have different etiologies and therapeutic management approaches. Recognizing the subtle nuances between these two heart sounds is essential for accurate diagnosis and appropriate treatment selection. By understanding the distinct characteristics of pericardial rubs and pericardial knocks, clinicians can effectively navigate diagnostic challenges and optimize patient care. Let's explore the hemodynamic changes associated with constrictive pericarditis, a condition characterized by the fibrotic constriction of the pericardium surrounding the heart. These changes can have significant implications for diagnosis and treatment. One hallmark sign of constrictive pericarditis is the paradoxical pulse. During inspiration, there's a precipitous drop in blood pressure, typically by 10 mm Hg or more, due to the constricting effect of the fibrotic pericardium on the heart's ability to fill during diastole. This paradoxical pulse often coexists with Beck's triad, a classic set of signs indicative of constrictive pericarditis. Beck's triad includes low blood pressure, distended neck veins, and muffled heart sounds. Recognizing these hemodynamic changes is crucial for diagnosing constrictive pericarditis and initiating timely intervention. The treatment of choice for constrictive pericarditis is pericardial stripping, a surgical procedure aimed at removing the constricting pericardium and restoring normal cardiac function. Early diagnosis and intervention are paramount for improving patient outcomes and preventing further complications. By understanding the hemodynamic changes associated with constrictive pericarditis and recognizing the importance of timely intervention, clinicians can effectively manage this challenging condition and optimize patient care. Let's explore the intriguing world of conditions associated with a low-voltage QRS complex on the electrocardiogram, ECG. This subtle finding can provide valuable clues about underlying systemic conditions affecting the heart. Firstly, scleroderma, a disorder characterized by the hardening and thickening of skin and connective tissues, can extend its reach to the heart, resulting in a low-voltage QRS on the ECG. Imagine the heart's electrical signals struggling to penetrate through the dense, fibrotic tissue. Next, myxedema, a consequence of hypothyroidism, can cause the accumulation of mucopolysaccharides in the heart muscle, leading to a similar ECG finding. Picture the heart's electrical activity getting lost in the sea of accumulated substances. Another culprit is amyloidosis, where abnormal proteins infiltrate the heart tissues, disrupting normal electrical conduction and resulting in a low-voltage QRS. Think of these proteins as unwanted guests wreaking havoc within the heart's electrical system, but the list doesn't end there. Conditions like hemochromatosis, sarcoidosis, and pericardial effusion can also manifest as a low-voltage QRS on the ECG. These conditions impose a restrictive or constricting effect on the heart, hindering its electrical activity. By recognizing the diverse array of conditions associated with a low-voltage QRS complex, clinicians can embark on a diagnostic journey to uncover underlying systemic diseases and tailor appropriate treatment strategies for their patients. Let's delve into the fascinating realm of pulse types and medical signs, essential components of cardiovascular assessment that can provide valuable diagnostic insights. During exams, you may encounter descriptions of pulse types rather than medical terminology. It's crucial to familiarize yourself with the characteristics of different pulses, such as the slow riding pulse associated with aortic stenosis, or the forceful rebounding pulse associated with aortic regurgitation. Understanding these nuances can aid in accurate diagnosis and clinical decision-making. Similarly, proficiency in recognizing various medical signs is paramount. Take, for instance, pulsus paradoxus, an exaggerated decrease in systolic blood pressure during inspiration. This sign can be associated with conditions like sleep apnea, asthma, and pericarditis. By grasping the significance of these signs, you can decipher underlying pathologies and formulate appropriate management plans. Applying heuristics or mental shortcuts can further enhance your diagnostic prowess. Visualizing aortic regurgitation as a floppy, leaky valve and aortic stenosis as a tightened stenotic valve can help you comprehend the associated hemodynamic changes and pulse characteristics more intuitively. By mastering pulse types, medical signs, and employing heuristic approaches, you can navigate the complexities of cardiology with confidence and precision, ultimately improving patient care outcomes. Let's explore the key differences between two common valvular heart conditions, aortic regurgitation and aortic stenosis. Understanding these distinctions is crucial for accurate diagnosis and appropriate management. In aortic regurgitation, the aortic valve is insufficient, allowing blood to flow back into the left ventricle during diastole. This results in a forceful rebounding pulse known as Corrigan's or Watson's water hammer pulse, a palpable sensation of a strong bounding pulse felt during each heartbeat. Additionally, aortic regurgitation is associated with a widened pulse pressure, reflecting the increased difference between systolic and diastolic blood pressure. In contrast, aortic stenosis is characterized by a narrowed aortic valve, which obstructs the flow of blood from the left ventricle to the aorta during systole. This leads to a faint, slow-rising pulse known as pulsus tardus, a delayed and diminished arterial pulse. Furthermore, aortic stenosis typically presents with a narrowed pulse pressure, indicating reduced stroke volume and cardiac output. By recognizing the distinct pulse characteristics associated with aortic regurgitation and aortic stenosis, clinicians can discern between these two conditions and tailor appropriate treatment strategies for their patients. As you prepare for your exam, it's essential to employ efficient test-taking strategies to maximize your success. Let's explore some tips to help you approach the exam with confidence and clarity. Firstly, strike a balance between memorizing key facts and understanding underlying concepts. While memorization is important, focus on grasping the fundamental principles that govern the subject matter. This will enable you to apply your knowledge more effectively and tackle a wider range of questions. Utilize efficient test-taking strategies during your preparation and on exam day. Identify recurring themes and patterns across different topics and make connections between seemingly disparate concepts. Applying heuristics, mental shortcuts, or problem-solving strategies can also be invaluable for navigating complex topics and arriving at correct answers efficiently. Maintain a laser-sharp focus on the most important topics and questions throughout your preparation and during the exam itself. Avoid getting bogged down in excessive details that may not be directly relevant to the exam. Stay disciplined in your approach and prioritize the material that will yield the greatest return on investment in terms of exam performance. By adopting these strategies and staying focused on the essentials, you can approach the exam with confidence, optimize your study efforts, and maximize your chances of success. Remember, preparation is key, but so is a strategic mindset when it comes to test taking.